Deviated nasal septum is a condition in which the nasal septum is off-centered. Nasal septum is a wall of cartilage and bones that separate your nasal cavity. Some people are born with deviated nasal septum and some people have it due to the injury or trauma to the nose. There are many types of deviated nasal septum. First, anterior dislocation. The nasal septum is dislocated into one of the nasal chambers. Second, C-shaped dislocation. In this, the septum is deviated, simple curve to the side, giving it a C shape. S-shaped deformities. In this, the nasal septum is deviated in S shape. This causes obstruction in both the nostrils. Fourth one is spruts. It is a shelf-life projection. It touches the lateral wall. Up to 80% of people have deviated nasal septum. Some people don't even realize that they have deviated nasal septum because they don't have any symptoms. People with severe deviated septum may notice changes in the shape of their nose and other symptoms like difficulty in breathing out of the one or both the nostril, headache, facial pain, nasal congestion, noisy breathing, nose bleeding, snoring, chronic sinusitis, that is inflammation of your nasal sinuses. Sleep apnea. A healthcare provider diagnoses a deviated nasal septum by taking a health history, by asking about the symptoms and previous injury to the nose. Do physical examination and use imaging scan like X-ray, CT scan or MRI. Treatment of deviated nasal septum depend on severity of your condition. Most people with this defect does not need any treatment because they have very mild or no symptoms. For severe deviation, physician performs a surgery called as septoplasty to straighten the nasal septum. In some cases, surgery called rhinoplasty is done to reshape the nose.